What is your experience with tapering the application of topical steroids?
Well, going back 35 years, I tried. I tried strenuously to taper slowly and to step down to weaker and weaker strength steroids and to ultimately stop the oral, maybe with tapering or instantly, totally. Did not get away with it. Absolutely did not get away with it. So as the dose of the oral went down to 5 milligrams, 7.5, 10 milligrams, they started flaring. When the dose of the cream, not middle strength, but just a little level below middle strength was applied, they would flare. So it came down to, it's absolute. You cannot get away with tapering. I just put the misery off. No, I continued the misery for more months by tapering. You have to go through the misery. You stop total, absolute total. You don't step down opium. You don't step down alcohol. You don't step down amphetamines. You stop cold turkey. That's the only way to handle this.
And I don't mean to put words in your mouth, but if one is tapering, does that flare become a different type of flare during the tapering process, or will it hit with the same level of intensity?
Probably won't. Well, if they're in my hands and we know what's going on and they're wizened about the mechanisms, they won't let it flare too far. So right away there's a phone call, or right away they start putting more steroid on because they're not in anybody's care yet, and they go back to normal until they flare again. So it never reaches terrible proportions. But it dawned on me after probably 10, 15, 20 patients, absolutely cannot get away with tapering. Absolute.
Because it prolongs.
They'll flare again when you get not near normal, but when it's lower than what they've been used to, they begin getting red and symptomatic again. So you're back to stage one, step one.
So cold turkey is the answer.
The only way. And then help them through with symptomatic medicines.
Please like, share, subscribe.